Very good morning. Today we will discuss about one important clinical problem, that is drug interactions. The person goes to the physician with one or more problems, then the physician will prescribe two or more drugs to achieve the set goals. In that situation, there might be a chance of interaction between the prescribed drugs, which ultimately leads to unwanted adverse effects. So the adverse effects which results due to the consumption of two or more drugs are usually termed as drug interactions. So today we will discuss briefly about the concept of drug interactions. So drug interactions is usually defined as the modification of the effect of one drug by the prior or concomitant administration of another. The drug whose effect has been changed is usually termed as object drug, and the drug which is responsible for the change in the effect of object drug is usually defined as precipitant drug. If you come to epidemiology, a study conducted in Harvard Medical University reported that 8% of the adverse events are due to drug interactions, and the US Community Pharmacy study revealed 4.1% incidence of drug interactions in hospitalized patients, and an Australian study found that 4.4% of all adverse drug reactions which resulted in hospital were due to interactions. So, as far as drug interactions are concerned, they are not minor, they are very major as far as the treatment is concerned. The possible risk factors of drug interactions are polypharmacy, that is taking more than one drug at one time, multiple prescribers, multiple pharmacies, that is visiting more than one pharmacy for a set of problems, the genetic makeup, special or specific population like females, elderly, obese, malnourished, transplant recipients, specific illnesses like hepatic problems, renal dysfunction, and consumption of drugs having narrow therapeutic index like digoxin, insulin, lithium, etc. And the possible consequences of drug interactions include loss of therapeutic effect, toxicity, unexpected increase in pharmacological activity, beneficial effects which are seen in some situations which are usually due to additive or potentiation or antagonism between the drugs consumed, and chemical or physical interactions which are usually seen as IV incompatibility in fluid or syringe mixtures. So if you come to the classification of drug interactions, they are basically divided into two types, namely pharmacokinetic interactions and pharmacodynamic interactions. So the pharmacokinetic interactions involve the effect of a drug on another drug kinetic, that includes absorption, distribution, metabolism, and excretion. Whereas pharmacodynamic interactions are those in which the pharmacological activity of one drug is changed or modified in the presence of another drug, namely synergism, antagonism, altered cellular transport effect on the receptor site. So first we start our discussion from the pharmacokinetic interactions. So this type of interactions usually occur at four levels, namely absorption, distribution, metabolism, and excretion. So if you come to the absorption, The change of the absorption of one drug by another drug might be due to either altered pH, altered bacterial flora, formation of drug chelates or complexes, drug-induced mucosal damage, altered GIP motility. So the first possible mechanism is altered pH. The non-ionized form of a drug is more lipid-soluble and more readily absorbed from GIP than the ionized form does. For example, antacids, when they are co-administered along with ketoconazole, they decrease the absorption of ketoconazole by altering the pH of the stomach. Therefore, such drugs must be separated by at least 2 hours in the time of administration in order to avoid such interactions. The second possible mechanism is altered intestinal bacterial flora. So antibiotics, when co-administered with digoxin, they increase digoxin concentration and increases its toxicity by killing a large number of normal flora of the intestine. The third mechanism involved is complexation or chelation. Tetracyclines, when co-administered with milk or iron preparations, it results in the formation of unabsorbable complex. The fourth mechanism is drug-induced mucosal damage. Administration of anti-neoplastic agents such as cyclophosphamide, vincristine, procarbazine inhibits absorption of several other drugs, namely digoxin. The last mechanism is altered motility. Intake of metoclopramide increased absorption of cyclosporine due to the increase of stomach emptying time, thereby increases the toxicity of cyclosporine. So these are the 5 possible mechanisms involved in the drug interactions at the absorption level. Displaced protein binding. It depends on the affinity of the drug to plasma protein. The most likely bound drug is capable to displace others. The free drug is increased by displacement by another drug with higher affinity. If you come to the example, phenytoin, talbutamide and warfarin, which are having high protein binding capacity, when co-administered with aspirin, sulfonamide, phenylbutazone, then these drugs concentration in the plasma usually increased due to their protein displacement mechanisms. The next drug interaction is at the metabolism level. The effect of one drug on the metabolism of the other is well documented. The liver is a major site of drug metabolism, but other organs can also do, namely WBC, skin, lung, and GIT. Cytochrome P450 family is the major metabolizing enzyme in phase 1, and the phase 2 reactions are carried out by non-cytochrome enzymes. Therefore, the effect of drugs on the rate of metabolism of others can involve the following examples. The first one is enzyme induction. The drug may induce the enzyme that is responsible for the metabolism of another drug or even itself. Example, carbamazepine increases its own metabolism. Another example is when phenytoin is co-administered with theophylline, then it leads to the decreased levels of theophylline by increasing its hepatic metabolism, thereby reduces its action, and vice versa is possible. So enzyme induction involves protein synthesis, therefore it needs time up to 3 weeks to reach a maximal effect. Enzyme inhibition. It is a decrease of the rate of metabolism of a drug by another one. This will lead to the increase of the concentration of the target drug and leading to the increase of its toxicity. Inhibition of the enzyme may be due to the competition on a binding site of the enzyme. For example, if you administer carbamazepine along with the verapamil, the effect of the verapamil will be predominant because of its inhibition effects on the enzymes. Another example is co-administration of erythromycin along with estomazole and terpinadine. So in this situation, erythromycin will inhibit the metabolism of estomazole and terpinadine, thereby increasing their serum concentration, leading to the life-threatening cardiotoxicity. Onset of drug interaction. Sometimes it may be seconds or up to weeks. For example, in case of enzyme induction, and it means weeks for protein synthesis, while enzyme inhibition occurs rapidly. The onset of action of a drug may be affected by the half-life of the drug. Cimetidine, for example, cimetidine inhibits metabolism of theophylline. First pass metabolism, which is the most common adverse effects in oral administration. The next level of drug interactions is drug interactions at the excretion level. So the first possible mechanism is interaction at active tubular secretion. It occurs in the proximal tubule. The drug combines with a specific protein to pass through the proximal tubule. When a drug has competitive reactivity to the protein that is responsible for active transport of another drug, this will reduce the drug excretion, increasing its concentration and hence its toxicity. For example, when probenecid is co-administered with methotrexate, then the probenecid decreases tubular secretion of methotrexate, thereby increases the systemic concentration of methotrexate with its toxicity. The next drug interaction is at tubular reabsorption level. Excretion and reabsorption of drugs occur in the tubules by passive diffusion, which is regulated by concentration and lipid solubility. Ionized drugs are reabsorbed lower than non-ionized ones. For example, when sodium bicarbonate is administered with lithium, then the sodium bicarbonate increases lithium clearance and decreases its action. The second type of drug interactions are pharmacodynamic interactions. It means alteration of the drug action without changing its serum concentration by pharmacokinetic parameters, so which include additive effect, synergistic effect, potentiation effect, antagonism. Additive effect means in which the effect of one drug is almost becomes double by the addition of another drug. Synergistic effect, in which the effect of combination of two drugs is greater than the sum of the individual effects of two drugs. Potentiation effect, in which the drug which is not having any effect increases the effect of drug which is having a particular pharmacological activity. And antagonism is in which the effect of one drug gets nullified by the presence of another drug. So these are the four different possible pharmacodynamic interactions. So these pharmacodynamic interactions occur either due to the interaction of drugs at the receptor level, which includes competitive and non-competitive interactions, or by alteration in sensitivity of receptor, either by altering the number of receptors or affinity of receptors, or by alteration of neurotransmitter release, or by alteration of electrolyte water balance. So the other type of interactions which require a mention is drug-food interactions. So especially if you consume the drugs, namely grapefruit juice, then it has the ability to interact with many drugs like terpinadine, cyclosporine, celodipine, furanocoumarin compounds. So in such case, the grapefruit juice should not be consumed along with these drugs in order to achieve the set goals of these drugs. So this completes our discussion regarding the topic, that is drug-drug interactions. So the physicians and the pharmacists should be cautious while prescribing or dispensing the drugs to the patients. They should give clear instructions to the patients in order to avoid such unwanted drug interactions. Thank you very much for giving this opportunity.